Hey everybody, Dr. John Willardson here with Memo Hea. We're here in beautiful Newport Beach, California. And welcome again to Trust Implants, our live stream. And today we're going to talk about a few different topics. Most recently in the last, I guess it was last Monday, had a consultation. The patient came in and they just wanted to do one arch, or actually one quadrant, so one area of their mouth. And so after doing their CT scan and kind of evaluating the patient's situation, after looking at her case, it was really important that I did her whole mouth in order to give her the aesthetics, the functionality, restore the like I talk about, the biomechanics, so that she chews on the right side and the left side equally, and also to give her a smile that is symmetrical and has that it's complete. And of course, the reason that she wanted to just do a portion of her mouth was for financial reasons. And so on my end, I would rather discount my fee a little bit and be able to give her that full complemented smile rather than just do a portion of the work. And I want to show a few different cases here. So again, this is just a fixed upper prosthetic, and you can see, I mean, it looks great, looks beautiful, and in the mouth it looks even better. This is on the model. But let's take a look. Well, first I want to put a shout out to my man here, Seth Willardson, my son. It was his birthday last week. He is actually serving as a missionary in the Dominican Republic, and he's winding his mission down right now. He gets home January 20th, and you know, this kid has put just as a little side note, I mean, he has put his heart and soul into serving the people of the Dominican Republic. And, you know, just his story is so amazing. It took him about 2 years just to get out on the mission. He was actually bit by a rattlesnake before his mission. And during that time, it was an interesting story. So he was in the backyard of one of his friends, or having is actually what they call a farewell. So he had one of his buddies was leaving on his mission, and they were up in El Dorado Hills, California. Apparently there's a lot of rattlesnakes up in that area. And so they were in the backyard of his friend, and they were at this little kind of swimming pool party, and the dad was barbecuing, and Seth went up to get his hamburger or whatever it was they were barbecuing at the time, and all of a sudden he felt like he got stung by a bee, or he didn't know what it was. Fortunately, the mom, LaDawn, who she knew right away as soon as she saw his foot, and it had, you know, 2 red dots in the top of his foot, and she knew right away it was a rattlesnake bite. And so after being in the ICU for 10 days, getting 14 units of anti-venom, which is a lot, Loma Linda University is one of the highest rattlesnake bite treatment centers. That's where I went to school. And talking to some of my peers, you know, 5 doses is a lot. And Seth got 14 doses. That's how much venom he had in his system. They were considering, as it worked up his leg and the necrosis was starting to set in. Fortunately, they saved his leg, they saved his foot, but it did require multiple surgeries in order to get his foot in a condition to where he could, because as a missionary, they walk for, gosh, I don't know, they probably walk, what would you say, Memo?
10 miles a day.
10 miles. I mean, no joke. I mean, especially in a foreign country, they walk about 10 miles a day or so.
At least, yeah.
So anyway, just a little shout out to him. It was his birthday last week. And, you know, he is just just grinding, just giving it his all, doing everything he can to finish up strong. So,
well, going along with that, Doctor,
yeah.
Think about how many 20, 21-year-olds are doing that.
Right.
Aside from being something from the church, is everyone at that age or even younger, they're already spending hours on social media and not really think about serving other people. Even us, we don't really dedicate that much time. So just the fact that missionaries go out straight 2 years, they have to completely dedicate their whole day to serving people, and sacrificing a few things. That, I would say, any 18, 19-year-old who has the opportunity to go do that, aside from the spiritual benefits of it, just the discipline and everything that you learn from it, like planning, talking to people, that you don't get that anywhere else. It's such a crucial age. And yeah, shout out to Seth. It's gonna be cool seeing him speak Spanish, the Dominican Spanish, when
right.
when he comes back. It'll be interesting seeing you, Dane, and Seth speak Spanish, because
I can't wait.
you learn in Argentina, right? So
it's a little rusty, but I did learn. At a certain point, I could speak pretty good, but it's been so long now. But to your point, for these young kids that are 18 to 21, 22 years old, they're completely separated, quote unquote, from the world. They have no phone, they have no social media, they don't even listen to the radio, they don't watch TV. They're 100% separated from what's happening in the world. In fact, we don't even really fill him in on what's going on in the world. He's just so immersed in what he's doing that he's fully dedicated his life to Christ, and he's doing everything in his power to demonstrate and to show the love that he has for his Savior and for God. And what better way? And I'm not by any means, please don't take this as a prideful thing, but what better way to demonstrate your love for God than to sacrifice basically your life? You've given up everything. You've given up girlfriends, family. He's a professional motocross racer. He gave up all of the things that he loves to do to demonstrate to God that he is willing to sacrifice everything. So, it truly is remarkable. And I'm not boasting about Seth, because I think there's 63,000 missionaries out there in the world that are doing the same thing. And every single one of them has set aside their own desire, their own will, and put it, basically turned it over to God to let him do with their life what they couldn't do for themselves. And I've seen a lot of missionaries come home, and it's a true transformation. And so I just want to give a little shout out to Seth and just for his hard work and dedication. And transitioning from there, okay, so we see all getting back into the the world of implants and dentistry, and thank you guys for watching and tuning in. And we're going to talk about the idea of comprehensive reconstructive dentistry, and what does that mean? So, as I kind of mentioned in the beginning, the idea of, and I get it, because finances always play such a critical role in being able to do these cases. But at the end of the day, I have to consider, what is my outcome going to be? What's it going to look like? How is the functionality? What's the biomechanics? How is the bite going to work? And then, of course, is it going to look amazing and transform, kind of like we talked about in our last week's live stream, and just the frequencies that we put off, the light that we put off to others, and that's all about how we feel about ourselves, right? If I feel good about myself, and which translates into feeling good about other people, and our smile, our mouth, and how we feel about our smile truly plays into that, because it's, for example, just a few years back, I was had done a long surgery. It was about an 8.5 hour, 9-hour surgery. I knew that I was kind of pushing it a little bit, and this was way back in 2004. But I did that case, long case, and I didn't really drink enough water. And long story short, I had a stroke, and on that day, of the stroke, my face, my arm, and actually I had the stroke. I was at the office, and everybody had already gone home, and my face went numb, my arm went numb, like it's almost like I had Bell's palsy, and I still have remnants of it. And the left side of my face is still numb, and so I can relate to the sense of and I'm still to this day very self-conscious about that. I feel like the entire world looks at me and think like, what's wrong with this guy, because my face does, like, there's an asymmetry there. There's some form of asymmetry. Most people don't know the backstory. They don't know why that's the case. They probably just think I've got some I don't know, something wrong with me. But so I can relate to the fact that, and maybe people don't even notice it. My wife will say, well, I can't really see it. I see it quite a bit, but.
Doctor, I was going to say, now that you, to this day, that you're saying that.
Yeah.
I had never noticed before. Like, and I actually
really?
think, so.
Yeah. So, and I appreciate that, but subconsciously, I feel like people are looking at me like, oh, what's, something wrong with this guy? What's going on? But, I did have a stroke, but that subconscious feeling like something's wrong with me is, it can be a very powerful thing. It can actually take over a lot of your interactions with people. Sometimes I feel like I don't really want to interact with people because I don't want to be judged by them for having, an anomaly, right? Or something that isn't quite right. So now transfer that into your teeth, mouth, and smile, because our smiles are such a huge part of our existence, right? I mean, we're judged by our smiles. People look at us and immediately, if you're missing, last night we were watching, this show, 1,000-Pound Sisters or something like that. I'd never seen it before, but apparently there are these two sisters that together they weigh 1,000 pounds, and it seemed like maybe just one of them weighed 1,000 pounds, but and it wasn't the weight that I noticed. It was the fact that they were missing teeth, and so we're judged by our teeth because, like I had said, I've said in past live streams or on YouTube, we first look at people's eyes and then we look at their teeth. And if there's even a small gap, if there's a space, if there's a black triangle, whatever the case may be, the person that you're talking to, their eye goes right to that spot. So,
or doctor.
Yeah.
Just to add to that, I would actually say that we actually think we're being judged. Like we judged ourselves, because
yes,
you mentioning that story made me think of, because last time we kind of talked about this, and I was really thinking about how could I relate to our patients. And I remember when I was like in high school, like sophomore, junior year, everyone gets acne, right? Well,
yeah.
A lot of people. And so I had acne, but for me, like at that age, it was, because at that age, you really care about what other people think, right?
Yes.
It was even hard to like look at myself in the mirror because I didn't want to see it, because it was there. And like you said, every time I would talk to someone, even if they didn't, I would think, oh, they're noticing my acne, which my attention, my focus was put into that, right? Which is something negative. And then I automatically would radiate that like negative frequency, that low frequency that comes off as like, insecure or like low self-esteem. which in reality, maybe they are noticing that or they're not, but it really, like, it's how you feel about it, where you putting that focus. And same with our patients, right? Like, maybe they do notice and they like take a glance at their teeth, and the other
Right.
person may not care, but because they looked at it, our patients or, you know, ourselves were like, oh, they think I have bad teeth, and you're automatically have those negative thoughts. You put that focus into that, and you're not really being your true authentic self. And then you're radiating, like we said last time, like low frequencies. You're not really being your true self. Like, that's what we want in life, right? That's what we want here. We want people to get their smile back, their confidence back, and just radiate like their true self, their true frequency.
Yeah, for sure. And, you know, I appreciate you bringing that up, you know, just, you know, and what teenager or high schooler doesn't have or have had some episode of acne, right? But even if you just had it for a short period of time, you know, you're kind of defining yourself by maybe a flare-up of acne, when in reality people around you aren't really even noticing it, you know. But that's, you know, that is kind of our own psychology. We want people to think the best of us, and we're our biggest critic. So any little flaw that we see on ourselves, it's exacerbated or kind of highlighted in our mind and in our brain, and we think that the world is judging us because we're judging ourselves so harshly. So, and so, you know, cases like, you know, like this, where patients have lost all of their teeth. You know, this is a patient where the placement of the implants was such that, again, not to belabor this, but the positioning of these implants made it so I had to do a lot of work around, because there was not a lot of planning that went into it. In fact, you can see there's a implant right in the midline, and there's not a tooth ever that's right in the midline, you know. And so I ended up having to remove this implant and then place another implant just to the side of it. So the key is that the plan, the design, the pre-planning is critically important, so that we can achieve those ideal aesthetics, so that once this case is done, the patient can now have their confidence restored to the point to where they no longer have these self-conscious feelings or feelings of inadequacy, or when they meet somebody, they restore that confidence. And fortunately, with what we do here at Trust Implants, we are able to do that. So here's a case or a patient where, again, she had gone to multiple doctors, was told she's not a candidate. And I talked about this case a few live streams ago, but I wanted to bring it up again because we delivered her just the kind of the trial version of her teeth last week. And you can see, you know, for those who are dentists, you can visualize there's just no bone here whatsoever. Here's kind of the model, and you see how there's very little bone on the lower jaw, the upper jaw, literally no bone at all. And so, but with proper planning and with the proper knowledge of knowing how to graft this case, knowing how and where to place the implants, we're able to, you know, design something that's going to give her what she's lost. And she was pretty desperate at this stage. She was very desperate to have something done because she was so tired of the dentures, and also was very frustrated because she'd been told so many times, you're not a candidate and you're never going to get implants. I don't remember exactly how many people told her that, but there's a couple of things that play into it here. One is, I think that the I would say they probably judged her in the sense of, well, you probably can't afford to have this work done, so we're not even going to take the time to even put a treatment plan out there. Because by the time the patient's lost this much bone, it's expensive to regenerate the bone and then to get the implants in and then to make the teeth, and it's just a process. It's very different than somebody who comes in and they've got sufficient bone, pretty slam dunk, stick the implants in, make the prosthetic or the teeth, and you're good to go. Whereas this sort of case takes, a good year and a half to finish. And I talked about this last time. So after I had placed these implants and did the bone graft, regenerated about 10 to 12 millimeters of bone. Each one of these implants is 11.5 millimeters by 5, so 5 by 11. Nice, big, thick, long implant. And on the mandible, you can see on the lower jaw, I did what's called bicortical fixation. So around the bone, you have the cortical bone, which is hard, and then you have the cancellous bone, which is like the bone marrow in between the cortical bone. And I wanted to fixate on the hard pieces of bone. So just kind of thinking of my methodology here, I'm going to fixate on the crestal, the top cortical bone, and then the inferior bone. So I get what's called bicortical fixation. So I'm fixating the implant on the cortical bone on the top and the bottom. So again, that was all part of my diagnosis and planning to ensure that this patient gets what she needs, and we were able to give her exactly what she needed. But I had to think outside the box. I had to think, okay, how are we going to regenerate the upper bone, and then how can I give her implants on the lower, because the surgical aspect of this case is very different. When I approach the top or the upper and the bottom, my approach is very different for each one. And so, it's important that I consider all of that when I'm preparing for these cases and looking at every aspect and think, I had to think, what, I can do bicortical fixation, I can get these implants in, and she'll be just fine that way, rather than trying to avoid, because you actually have to perforate the inferior border of the mandible and in order to get that bicortical fixation, but it worked beautifully. So here's a kind of a model of the implants in place, and here is a picture of her. These are actually just temporary. So, but you can see we are on the trajectory, and we're on the path to finalizing her case. And what was in her mind an impasse, or that she wasn't a candidate, now here we are about a year later, and she has fixed prosthetics, which prior to that she was told she wasn't a candidate. So all right, so moving right along here. So
Doctor.
Yeah.
We have a visitor here. I want to welcome our visitor who's part of the team. He's been working. He does a lot of like the back office, like the not unseen stuff, but it's Dane. He's here visiting us. He works a lot. I mean, as you know, we're constant. That's why we have these live streams. We're constantly finding ways to improve the industry, to help the patients, to educate him, and he's also doing that himself. He's working on ways to help provide this treatment for patients that could be more affordable, because that's one thing that we see here, and those are the questions that we get all the time. So we have him here visiting.
Welcome, Dane. Glad to have you here. So Dane he's the financial wizard. So he's the one that will help patients figure out ways, because this is an investment, no matter how you slice it. So, if I show, an image like this, prior to having her implants placed and doing the final prosthetic, when she was in this state, can you imagine what's going through her mind? One is, how in the world am I going to be able to afford this? And two, I've been told by so many different other practitioners that I'm not a candidate. So a pretty hopeless situation, hopeless feeling anyways. And to catch wind or to hear the news that yes, you are a candidate, we just got to do a little bit extra work and think outside the box. And then B, we have the means, we have the ability to do different creative financing so that you can accomplish and get this work done. And that's how she ended up here. That's how she ended up moving forward with her case. These cases can be very expensive, well over $100,000 on a case like this. Not every case is that much, but there's no magic all on four that's going to make this case work. In fact, if they were to have just done an all on four in her case, without a doubt it would have failed, and she would have spent $50,000 or $60,000 for naught. So and so welcome, Dane. Thanks for being here, and we're grateful to have you because you do provide so much insight for patients in the financial aspect, because it is it's half the battle, right? Most patients everyone would be doing this work if it wasn't for the obstacle of the financial side of things and the cost to do the case.
Oh, Dane, you want to just kind of tell us a little bit about what you guys been working on and how? It's not we don't have it ready all the way, but just kind of what you've seen, because that's mainly the number one setback for patients.
Yeah. Sorry. Well, thanks for the introduction, you guys. I appreciate it. But I've been working behind the scenes, like Dr. Willardson mentioned. Cases can get really expensive, and this isn't a completely cosmetic surgery. Most of the time, these are cases that they're life-changing, their diets change, their lifestyle changes. So there's a lot more value than is what is initially perceived for these cases. So being able to finance them and being able to afford them is a huge part of our ability to provide this care for others. So oftentimes there's a couple finance industries that we work with, finance companies that we work with right now that provide a level of support when available, but there's a lot of contingencies, there's price caps, there's a lot of denial. In fact, statistically, only 24% of patients that come in are actually funded. So there's a huge handcuff right now. We want to help you, and the patients need the funding in order to do it, because most individuals don't have $40,000+ laying around to do this case. So I have a background in finance and in real estate, where creative finance is a huge aspect in order to fund giant multi-million-dollar properties. As an analyst, I learned the game of money, and so I'm trying to apply the game of money in order to make these cases affordable for patients, to make this available more widely. So that's what we're currently working on, working with a couple industries and a couple banks and a couple investors in order to make this more viable for patients widespread, because there's a huge affordability issue here. But yeah, so I don't know, is there any specific questions you guys wanted me to answer about the finances? Or
Dean, what would you say because most people can understand financing a car, for example, and I would say most have a car loan in place. What would you say is the difference in between financing reconstruction like this versus financing a car or something along those lines?
Right, yeah, that's a great question. So the main difficulty that we face, and why it's a lot easier to get funding for a new car than it is for something like these implant cases, is an unsecured versus a secured loan. So a secured loan, for example, a mortgage or a car payment.
Why is it unsecured?
Because let's say if someone were to get the loan and then default, you can't come back in and take the implants out of someone's mouth like you could a car or like you could a house. So that's where banks have a lot of, they're a lot slower to fund cases like this because there's no collateral. There's
Right.
nothing that the bank could come back in.
So it's unsecured.
So
basically.
that would be unsecured. If there's nothing that the bank can take over, for example, if you miss a mortgage payment, you foreclose on the house and the bank takes that back over, correct?
Right,
Or your
right,
car
right.
can come and get repoed. Whereas these implants, because Dr. Willardson's so good, they're in there for life. They're not coming out. So
Thank you
that's
for the
why
plug.
it's an unsecured loan, which is what makes it a lot more difficult to fund. And so that's where a lot of the affordability issues come from.
But there are banks that will, even though it's an unsecured loan, there are banks that will fund these cases.
Yeah, that's correct. That is correct.
And so, what is the? How do they mitigate the fact that they're unsecured?
That's where high interest rates come in. So banks have to mitigate their risk through interest rates. So unfortunately, that's why the monthly payments for something like dental implants can seem a little bit out of reach, is because the banks are rising interest rates in order to mitigate the risk of potential default without the ability to get back the initial investment.
Yeah, lately, we're seeing. Actually, just this last week, the lowest we're seeing, there are some rates out there that are about 5.9, so about 6% interest if you have really good credit. If you have decent credit, around 700, we're seeing about 10% or 9.9% interest. But the beauty is they'll go out 10 years. So let's say it's a $60,000 case, financed over 10 years. That's a payment that can be pretty manageable. But the payoff is huge. So again, like I've said 1,000 times to my patients, especially new patients who are just considering the procedure, if I could put this in your mouth for one day and you go out and try it and go eat a steak or whatever, they will come running back to me and say, okay, what do we got to do to get this done? Because it is truly that transformative. So even though it is an unsecured loan, even though you may have to pay a little bit higher interest because of the fact that it is unsecured, the investment is certainly worth it. It's worth every penny. Much more viable and valuable even than a car, because this, a car in 10 years will be worth pretty much nothing. Whereas 10 years after you have your case done and it's still in place and your daily lifestyle has drastically improved, you really can't put a price tag on that. You can't really, it's hard to say, what's the value of that, but because it is so transformative. And like we were talking about frequencies the other day, somebody if we go to some pre and post-op photos.
Can I add something real quick?
Yeah, of course.
So I agree totally with what you're saying. That's where a test drive comes into place with the car. If you get behind the wheel of a new car, it's faster than the one you drive, it's handles better, then that's going to help you make the decision to purchase that car.
Right.
And that's not something that is possible with implants. But
unfortunately,
we can look at the reverse, and we have countless testimonials of people who have gone through the process and they are at the end. They've received, their case has been delivered, and they give beautiful testimony about how life-changing it is.
Yes.
And so unfortunately, you can't test drive it before you buy it, but you can look, especially on our YouTube channel, there's a lot of great testimonials about our patients that have gone through the process, are in the tail end, and they say, I wouldn't change this for the world. It was worth every single penny. So even through all the financing, difficulties and nuances, we are able to finance cases. We can make it work for just about anyone, and the end result will be worth it every single time. We have countless testimonies and have heard some pretty life-changing stories from these patients.
Absolutely. In fact, I want to share. First, let's look in talking. Thank you, Dane. And let's look. So here's a pre-op photo, obviously before. And let's look at and think about, let's go back to our conversation about frequencies. I mean, she looks happy. She looks, and actually this person is a very, she's a light. Like, she has a very good frequency, even before she had her teeth done. She's just a very sweet, kind, gentle person. But let's look at her after. And can you see that? Can you see the transformation and just how her frequency immediately changes from here to here? There's just no comparison. Like, there's just no way to put in, to whether it's financial, I mean, in words, but you can sense and you can feel the transformation that occurred, and her life is now very much elevated. It's been restored.
And that's just a picture, doctor.
Yeah, that's just a picture. If you were to meet her in person, you know, let's see, if you were to meet her in person, you would even feel it even more, you know? So,
well, yeah, because going along with that, doctor, something that you mentioned probably like 5-10 minutes ago, you said that we restore their frequency, or like, you know, their confidence, or what, like the frequencies that they radiate.
Right.
I would actually say that you add to it, because they didn't have a perfect smile. They had a somewhat good smile, then they lost their teeth, so now they low confidence, you know, radiating that kind of like low energy, low frequency. But now they have a perfect smile. You're going from like a 1996 broken down Honda Civic to a Lamborghini, right?
Yeah.
Like, now you want to show it off. You want to go out. You want to eat whatever. You want to talk to as many people as you want. So you really are adding to it, not just restoring it to like zero.
Absolutely, without a doubt. And I really appreciate that memo. So this is a text message that I got. What day was that? I think it was either yesterday or the day before. Oh, it was it was on Saturday. So what's today? Today's Wednesday. Gosh, tomorrow's Thanksgiving. Happy Thanksgiving, everyone. Okay, so this is a patient who, I mean, hardworking guy. It's taken us 2 years to finish his whole case, top and bottom. But this was a text message that I got from him last week. So, and just random, out of the blue, and I think you can see that on the screen, right? And he'll text me every, I don't know, couple of months just to check in, and he's just a good guy. I mean, just a good, solid, hardworking guy that he's taken the steps, took out a couple of loans actually, to get his teeth, and I have his before and afters. I guess I could pull them up, but you know, he just took that initiative and he made it a priority so that he could get what he needs. And let me see if I can pull up his, let's see. Anyways, I don't think I'll be able to. But if we look at his, the text message that he sent, and he's like, thank you, or thanks for the new lease on life. You're a good brother. And of course, I'm in blue responding, of course, brother, glad you're doing good. And then that was actually a few weeks prior. And then he says, on Saturday, landed the job of my dreams. Wish and pray you are living the life of your dreams. You're a good man helping people. And then I just replied, you know, thanks, Keith, that's awesome. So glad to hear that. I appreciate you keeping me updated. You know, keep the faith, brother. And he says, I'm a believer. So I'm a believer in the fact that now that because he went through a lot to get to get to the finish, but he's sacrificed. He's spent the time, he spent the money. He was very, kind of followed all of the things that I had asked of him, for maintenance, to cleaning, to, doing the surgeries and the implants and the sinus grafts, and then making the final prosthetic. over time, now he really can appreciate and he understands the value of this. And now, landing the job of his dreams, and not that it is fully because of his teeth, but it certainly helps. Without a doubt, it helps. So, I'm grateful for patients like Keith who, one, share their stories, and two, can appreciate my message and the message that we have here at Trust Implants, that, reconstructing your mouth is to reconstruct your life. And so, we have so many other, I get messages quite often from patients who've been through the process, have taken that sacrifice and made the investment, and are now on the other side where they can really feel, appreciate, and value the work that we've done for them. So, okay. So, any other thoughts, Dane or Memo?
I had something interesting to talk about. It kind of goes along. Yeah, it does. I just recently finished reading for the second time this book. It's actually a pretty interesting book. It's called Breathe.
What's it called?
Breathe.
Breathe? Okay.
Yeah, it's by James Nelson. And oh my gosh, what an interesting book.
Really?
I would suggest, I actually think, people start suggesting books like they're suggesting movies or TV series, but like such an interesting book, a lot of research done. And it just talks about, they call it the lost art of nasal breathing, like just breathing through your nose. And
I heard Andrew Huberman talking about this recently.
Yeah,
about mouth breathers and nasal breathers.
Yeah, and that's what I want to get to, because in his book he went all over the world, right, trying to like discover and see what this he calls it an ancient practice, which it is. I mean, it goes back to the first breath of life, right? Like everyone is supposed to breathe like that, but about 50% of the population breathes through their mouth, and it's really bad for you, just in general. And one thing that he mentioned in that book said that he went down to Argentina to like some tribe where they teach their little kids at a very young age how to properly breathe through their nose. And how to do it. And he says that everyone, perfect jaws, perfect teeth. And I was like, what the heck? And it's just the way that you breathe, it can literally shape.
Don't they like tape their mouth or something at night, so they have to breathe through their nose?
Yeah, you can do that. I actually did that to just learn how to not breathe through my mouth. Because it's a real thing. And then obviously you can read something in a book or you can see it on a movie or whatever, and you have to do your research. And so even now I just on Google looked it up, and this is from the National Institute of Health.
Okay.
.gov, so it's a government website. It says, conclusion, all subjects with mouth breathing habit exhibit a significant increase in lower incisor proclination.
Incisor proclination.
Oh, okay, yeah, I'm mumbling that stuff.
No, that's fine.
Basically what it's saying is like, yes, like if you just breathe through your mouth, you're reshaping your jaw. And then here's another study showing that mouth breathing may also affect the alignment of your teeth. So even just that, I mean, we talk about teeth and having a good smile. Just simply switching to breathing through your nose can help you out in the long run a lot, right? With the way that your teeth are coming in, because you have a bigger, stronger jaw. Your teeth come in not as crooked, and it'll just be a lot better for people in the long run. So I thought it was really interesting because it correlates to what we talk about, right? We do want to help people, but we understand that it's an expensive procedure, and we'd rather see have you see Dr. Willardsen on YouTube than instead of real life, right?
Yeah.
So I thought it was interesting.
That it is interesting, and in fact, there's a term, and this term is, and this is a term that is basically mouth breathers. This is we've got different how our faces and our heads, cranium, facial bones, facial muscles, how they form. There's different terminology for different types of formations, okay? And so if you'll notice this picture of this girl here on the right-hand side of the screen, and you've seen people like this. I don't know if you guys can see the screen, but
Yep.
where they have kind of an elongated face. Their mandible or the lower jaw is recessed, so it's pushed back. The maxilla, the upper jaw, is kind of forward. And their tendency is, and you can, just looking at her, you know she's a mouth breather. I mean, when I look at her, I know right away she's a mouth breather. And this term that is dolichofacial, and what that means in Latin is painful face. And so dolichofacial patients are mouth breathers. They do have this tendency to breathe through their mouth, and over time, as they continue, so their heads are more narrow, their face is more narrow, elongated, their foreheads are longer, the mandible, the lower jaw is recessed. They're usually in what we call a class 2 position, so they're sometimes they can be in a class 3. Class 2 is where the upper front teeth are way in front of the lower front teeth. A class 3 position is where the lower, like a bulldog, the lower front teeth are in front of the upper front teeth. So there's different, and then a class 1 is where is how it should be, where they line up. So when you have braces, the orthodontist is going to try to put you into a class 1. But some patients, their skeletal position is different than their dental position. So they may be dolichofacial structure of their face, but an orthodontist will put them in a class 1 position. But that can stimulate severe mouth breathing. And as they continue to mouth breathe, their facial structure actually gets worse over time because they actually need what's called orthognathic surgery, where they reposition the mandible so that everything is brought forward, and then also open up the airway so they can start to breathe through their nose. But that's a very good point, and I did see that video with Andrew Huberman regarding mouth breathing and how bad it is, because it really dries out. One, it can desiccate or dry out your teeth, cause decay and cavities and a whole host of issues, not to mention if you don't use your nasal passages, if you're not breathing through your nose, eventually those too start to dry up. So the patients tend to have more allergies. They're more susceptible to have an allergic reaction to pollen or to whatever. And so, but interesting, the name of this, or this shape of face, is called dolichofacial, and that means painful face. I don't know why they call it a painful face, but in looking at some of these pictures, you can kind of imagine that. So, all right. So moving right along. So as we were talking about cases, and initially when we first started, I was talking about, doing half. I had a patient last week, and then I will finish up here real soon. And they just wanted to do the upper arch only. And I was pretty adamant because I cannot correct, I don't have control over their mouth if I don't do the comprehensive or the whole mouth. And so, here's some pictures of cases where just the standard all on 4, slap in 4 implants, make some sort of a bridge, leave this molar in. Don't even consider, this is not my case, no consideration whatsoever of the lower dentition of the lower teeth and how the articulation is there. The patient gets an all on 4 and they have a fixed set of teeth, but it doesn't solve so many of the issues, the mechanical issues and the aesthetic issues. Because if you end up, if I end up doing a case where, we do a all on whatever, but then we don't treat the lower teeth, I'm really not serving this patient very well, because, here at Trust Implants, if I were to do this case, we would be reconstructing not that we're taking the teeth out, but we would at least do restorations on the lower teeth so that the upper and the lower articulate perfectly. And so it is important that if you're having this sort of work done, that you consider doing the entire mouth. And you can see the difference here. Yeah, they did get an all-on 4, but the lower jaw, the lower teeth were not considered at all. And so the doctor was forced to follow the bite, the occlusion, the form of the bottom teeth with a brand new zirconia, upper prosthesis. Whereas had they done the lower arch and the upper arch together, everything would mesh and articulate, and the occlusion would be so much better. And we see this quite a bit, as we look at some of these cases. The patients end up getting whatever, all on 4 on the upper, or a denture. This looks like a denture here. And then they don't even look at or consider the lower teeth. And they all work together. It has to be done together, so, and if not, then you're only serving the patient halfway. You're not giving them really exactly what they need. And so here we're adamant that we look at the mouth completely. We restore the mechanics of the mouth. We restore the aesthetics. We make it so that when they chew, it's equal on both sides, and also that the shape and the color and everything matches perfectly, because that's such an important part of the process. So, here's a fixed upper zirconia prosthesis, but they did nothing to the lower teeth. They didn't do anything to try to make, and you can see the discrepancy, like the upper, it does not look anything like the lower. But here, if this were my case, these are not my cases, we would have treated the top and the bottom so that everything is in ideal balance, function, and aesthetics. And so here's a surgery we did on Monday. Patient everything's collapsed. He's ground down all the way through the enamel and the dentin. Here's kind of a view of what the upper teeth look like. So obviously all of these teeth have to come out. Here's his x-ray. We identify the infraalveolar nerve, the mental nerve, recognize what teeth need to come out, and then execute on his surgery. So we saved his lower teeth, we prepped those teeth, and here is his final x-ray. So we got 8 implants in the maxilla and the upper jaw, 3 on the mandible, and this is going to be a beautiful functioning case. And again, he had gone to multiple corporate centers, and every single one of them said, pull out everything, pull out all the teeth. But I feel like these lower front teeth are going to serve him well, because he'll be able to have that proprioception. When he bites down, he'll still be able to feel, and it'll feel more like natural teeth. And so that's what we do here. We're always looking for ways to improve upon their situation and not take away from it. And if we look at the cross-sectional view here, I can see on the CT I've got plenty of bone to place those implants. So prior to doing the surgery, I was able to anticipate where we were headed with it, and I knew exactly where I needed to place my implants. And you can see, sinus graft is here, bone in the sinus, implants solid in the bone, and that's what we do here. We don't avoid certain anatomical areas just because we don't know how to work around it. So, but anyways, we had a lot of information here today, but again, kind of take home, if you're in the category that you need to have this sort of work done, make sure that you find somebody who can look at the case comprehensively and restore your mouth to the most ideal condition given your situation, so that long term, 5 years, 10 years down the road, you've got something that's still functioning and that you can be proud of, and that your investment will be secure. And so, that's our message for today. And go ahead and subscribe and hit that like button. And we really do appreciate our viewers. If you have questions, comments, or want to do a video consult, we're happy to do that as well. We'll continue with our live streams, and we look forward to seeing you next week. I'm Dr. Willardson with Dane and Memo Hea, and we look forward to talking to you and having our next live stream next Wednesday. Thanks for being with us.